The Oxford AstraZeneca is slightly more effective at reducing the risk of hospitalization than the Pfizer vaccine, according to new research, amid criticisms from European leaders, including Emmanuel Macron, over the jab's efficacy. Public health officials have told ministers a single shot of either vaccine reduces the risk of being hospitalized by more than 90%, in a major boost for a return to civilization. Analysis of hospitalizations in England suggested the vaccine developed by scientists at the University of Oxford was marginally better at reducing the risk of a person becoming seriously ill. Ministers were also told the Oxford vaccine was proving more effective in people aged over 70, the Mail on Sunday reports. The UK has vaccinated almost 20 million people and offered a jab to the 4 most vulnerable groups as outlined by the Joint Committee on Vaccination and Immunisation. Official data shows deaths amongst the over 75s had fallen by 40% in the last week, with fatalities also dropping by 23% for those aged 65 and under. Several countries across Europe, including France and Germany, raised doubts over whether the vaccine worked and banned its use for the over 65s. Last month, the French president branded the Oxford vaccine quasi-ineffective in the older generation, but the jab was later approved by European regulators. On Thursday, Mr. Macron insisted he would now accept the jab if and when he is offered, after overwhelming evidence began to emerge in favor of the Oxford vaccine. Germany is now also set to make a U-turn after previously only approving its use in 1864-year-olds. Professor Thomas Mertens, head of Germany's Vaccination Commission, said there will be a new updated recommendation very soon. Professor Sarah Gilbert, who is leading Oxford's COVID-19 vaccine project, said real-world data now provides evidence of high effectiveness of both the Oxford AstraZeneca and BioNTech, Pfizer vaccines in preventing hospitalization in people over the age of 80 after a single dose, supporting our confidence in using this vaccine in adults of all ages. A separate study by Public Health Scotland showed the Oxford vaccine reduces hospital admissions by 94%, 4 weeks after the first dose. The research added for the Pfizer jab it was 85%, respectively. In the over 80s, combined data suggested an 81% overall reduction in hospital admissions. The UK has now administered the first vaccine dose to 19.7 million people, around 35% of all adults. The Joint Committee on Vaccination and Immunisation has advised that vaccination in order of age remains the quickest way to cut deaths, with age still a dominant risk factor for serious illness and death from coronavirus. Phase 2 of the vaccine rollout, which is expected to begin in April, will start with people aged 40 to 49 before moving on to younger age groups. Health Secretary Matt Hancock defended plans for the next stage of the UK vaccination programme by arguing on Friday it was the fastest and simplest way to roll out the jabs. He said the view of the government and its advisors was that the right thing to do, the moral thing to do, is to make sure that we save the most lives. England's Deputy Chief Medical Officer, Professor Jonathan Van Tam urged people who had been given the jab to stick to the rules. Speaking on Friday, he said, "Do not wreck this now, it is too early to relax. Just continue to maintain discipline and hang on just a few more months."